So in this video, I want to explain the differences between the types of anesthetics and what that means for you as a patient, and why we use these different types. Because there's obviously slightly different indications that suggest that this may be the right thing to use for you. So bearing in mind, these are the broad classifications that me as a surgeon explains to a patient. I'm not an anaesthetist and I'm not professing to be an expert in this. So broadly, you break them down into a local anesthetic. The second one is sedation. And then the third one is a general anesthetic. So a local anesthetic is what it says. So you're injecting something in and around a specific area. So it's injections and they just treat that one area that we're going to be operating on. So that can be, a face, it can be an entire arm, but it's to that particular area. So you can call it local, or in reconstructive surgery, we do use a regional. So that numbs the entire arm, for example. So sedation is when patients are given medications and they help to make them sleepy. So they're sleepy, they don't remember much, and you don't feel anything. But this is a really key differentiator between sedation and a general anesthetic, is that you breathe for yourself. Okay, so general anesthetic is, again, you're sleepy, but importantly, there are medications to decrease the muscle movement. So because they're relatively indiscriminate, it can affect the breathing. So in that case, in a general anesthetic, you'll have a tube and that machine helps us to make sure that the machine is breathing for you. Whereas with the sedation, the patient is breathing for themselves. So broadly, these are the three different types. If we talk about when we can use this, local anesthetics, we can use, for example, eyelid surgery. You can use it for a lip lift and a brow lift. Depending on how the patient is, some people may be able to tolerate a facelift, but that can be difficult. Sedations, they're the ones in between. So you can do liposuction, you can have a facelift here quite easily with a top-up of local anesthetic. In general anesthetics, where it's really important that the muscles aren't moving, for example, a tummy tuck, some of the breast surgery and things like that. So those are the different bits where it's important that we've got absolute control to make sure that we can control the surgical outcomes as well. But broadly, by understanding how this feels, you can imagine this local anesthetic is the quickest to recover. The sedation can recover within 5 minutes, from what I've told by the anaesthetist, after the meds are stopped. And for a general anesthetic, it can be as quick as 5 minutes, but sometimes it can take 2 hours or so. With both of these, the body has to wash out the medication. So that can sometimes, the after effects, the hangover effects can last for, a day or two sometimes as well.